Hello, everyone. Thank you for joining us for Ask Asbury. April is Parkinson's Awareness Month, and today I am so honored to have with us Dr. Casavetes from George Washington University. Dr. Casavetes, thank you for joining us.
Yes, thank you for the invitation. I'm very happy to be here.
I was wondering if you could take a minute and tell our guests about yourself and your background, your expertise, and what drew you to specialize in movement disorders.
Yes, so currently I'm an assistant professor of neurology at George Washington University. Uh, I'm originally from Greece, and that's why I have a very long name and I have a Greek accent. So I did my medical school in Greece. This is where I grew up. And then I left Greece after medical school for the UK. So I was in the UK, in London for about 5 years. I did master's degree there and a PhD. And then I decided I've had enough with Europe and I want to move to America. So I moved to the United States for the rest of my training, which is my neurology residency. I did in Boston University. So I was 4 years in Boston. Then I did my specialty, subspecialty, I should say, the fellowship in movement disorders at the NIH, just outside DC. And then I practiced for 3 years. I was faculty at the University of Utah, actually in Salt Lake City, and I recently moved back to DC. I joined George Washington University last September, and as I said, I'm an assistant professor of neurology. I see patients with movement disorders. Most of my work is outpatient work here at the university, but I do some inpatient work as well.
Wow, it's quite a resume you have there. Um,
Yes, thank you.
is- um, so for those who might not be familiar, can you explain what a movement disorder is and which conditions fall under that category?
Yes. So movement disorders are neurological conditions that cause problems with movement. That's quite self-explanatory. But we are focusing in some specific conditions. For example, we're focusing in conditions like Parkinson's disease, essential tremor, dystonia, and other conditions. This would be different, for example, in a patient that has a stroke and they have weakness,
Mhm.
or a patient that has a peripheral nerve problem, like peripheral neuropathy, or they injured their peripheral nerve and they have weakness. So movement disorders, usually we categorize them in two categories, really. These are the movement disorders that cause too much movement when a patient they cannot stop moving. For example, they may have tremor, or they may have some muscle spasms, or they have tics or jerky movements. And then there are the other kind of movement disorders, the other category, which is where the patients have less movement than normal. And this, we call them hypokinetic movement disorders. And this is a good example is Parkinson's disease, where the patients have less movement than normal. They have
Mhm.
more stiffness and so forth.
Wow. It's really frustrating, I know, for a lot of people with Parkinson's, because the symptoms can vary and they can even vary in intensity or time of day and all kinds of challenges with that.
Yes, for sure. Patients with Parkinson's disease can have many different symptoms. Not everybody gets all the symptoms. And so it's true they can have different motor symptoms and they can have also different non-motor symptoms. The
Mhm.
motor symptoms that usually we deal in Parkinson's disease are tremor, slowness, that we call it bradykinesia, which is slowness, and stiffness. We call it rigidity in the medical setting. So tremor, slowness, and stiffness are the main motor problems. And I should say one extra is balance problems. Balance problems is a little bit more complex than just a motor problem. Um, and then you have non-motor symptoms that are, we can talk about them. Um, but again, not everybody gets everything.
Mm.
So a lot of
Yeah.
times I get I get a question about the patient, what should I expect? That's that's very hard to answer because um, I can throw some symptoms, but I'm not sure if the patient is going to get the symptoms anyway.
That's true. So, do the symptoms progress over time or not necessarily? Or like how does, especially in Parkinson's disease, how does that work?
Yeah, so Parkinson's disease, unfortunately, is a progressive disease. So we expect the patients to progress over time. Um, that's a natural history of the condition. Now, we have a lot of medications and ways to actually help with the symptoms, provide symptomatic relief, and keep the symptoms at bay, reduce the symptoms for a period of time. And that can be pretty long period of time. Um, so the progression, we expect some progression, but the rate of progression is really what matters most. So um, if you have somebody who progresses very slow, let's say they're diagnosed in their 60s and they're progressing very slow, in 20 years, they may still take some medications and have some symptoms. But in their 80s, a lot of people have a lot of problems. So, that would be very different from a patient that is diagnosed in their 60s and then they progress faster, within a few years. They may have falls or cognitive decline, and that can be, very challenging to treat and to experience, from the patient perspective.
Yeah, it sure
So
is.
progression is expected, but it's very variable between
Hmm.
patients.
Yeah, it can vary. I get that. So tell me, this is like my favorite topic now. We're moving into my area of expertise, but so we've seen increasing evidence that exercise plays a significant role in managing movement disorders. So can you explain how physical activity benefits the brain and body, like in conditions like Parkinson's?
Yeah, so I think if the viewers need to take one point out of this discussion, I think this would be the point to get out of it, that exercise is very important for Parkinson's disease. And I would generalize a little bit more and say that exercise is very important in general,
Mhm.
even without an underlying neurodegenerative disease. It's very important for aging in general. Um, so yeah, this can be a very big discussion, but some points that I can share would be that first of all, exercise can help in many areas in Parkinson's disease, um, including the movement, which is the most obvious, but also it can help some of the non-motor symptoms. So it can help the sleep, it can help cognition, can provide benefit for mental health. So by exercising, you're not really just targeting the slowness in your left hand, you're really targeting holistically many symptoms. So this is really important. Another point I want to make is that even walking or natural movement, we it's so easy when we're young, and it happens automatically. We don't even think about it. Um, but really, we need to train. When we learn to move, when we learn how to walk as babies, we train and train and train. So I think that we should continue training. We should continue the exercise in adulthood in order to be at a very good, position, let's say, to have the skills, the strength, the muscle. So when, we're dealing with a neurodegenerative disease, we are really in a very good spot as we expect to have, you know, muscle loss and weakness, which are normal. This is normal aging. We expect to have some of this is going to happen for sure, even without Parkinson's disease or any neurodegenerative disease. If we start, in a good, better level, then the disability will come much later in the disease. And it's really fascinating to see how patients, um, when they get back from therapy, they are so much better. And people really don't believe that you can train walking. Says, I'm doing walking all my life. That's not something that I need to train to do walking or balance. But still, you really need to train
Hmm.
walking, to train balance, and and it's really fascinating, to see a patient that uses a walker and then come back and they don't need the walker.
Yeah, I love that. I love those victories.
Yes,
That's
yes, for
fantastic.
sure. I think exercise, I mean, in my practice with Parkinson's disease, exercise and medication, the main medication, which is the levodopa, those two are the pillars of the therapy. Really are very, very important to try to titrate the medications as as it's necessary, and then really focusing on therapy.
Yep, on movement and exercise. Yeah. So let me ask you a specific question about types of exercise, because in the research we've seen that programs like boxing and rock climbing have gained popularity, especially for people with Parkinson's. And now, can you explain why that would be particularly effective from a neurological standpoint?
Yes, I'm sure you probably have your own ideas, and I always appreciate the therapist's input. Um, but I'll tell you, I think that there's a lot of research for many years now with regards to what type of therapies, and so I remember during my PhD there were some studies with tango in Parkinson's, and so I was in London at that time. There were classes with tango in Parkinson's all over the place, and patient groups would have tango classes and so forth. And then there were studies with Tai Chi and other things, and pretty much every study that has been done with exercise is a positive study. Um, so
True.
more recently, we boxing has been very popular and climbing as well. Sure. I think we don't know very specifically what exactly is the exercise and specifically the dose of the exercise that we need to, absolutely recommend to the patients. But we know that, for example, I think these types of exercise work because they involve big muscles. They are kind of compound movements. You don't really exercise one specific muscle, lifting a dumbbell, you exercise your biceps and kind of you don't want to isolate the movements. I think those exercises they involve big movements, compound movements, and this is the type of movements that you want to train to exercise because this type of movements translate to everyday life as well. So, I mean, what is important in patients is that if I fall down, can I stand up? I mean,
Hmm.
if you're on the floor, you cannot get up, that's very limiting. Um, so these involve big movements, big muscles. These are compound movements. Or can I lift something, above my head? Can I put, the cap on the cupboard? Can I carry a bag of groceries? So these are really big movements. And also with these exercises, you get balance exercise. So in boxing, you move the legs, you exercise balance. Um, and you exercise and the last thing is strength, so you all these exercises involve some resistance that would help with strengthening, and I
Hmm.
think that's really really important to have good strength so you can use then this strength in your everyday life without
Yeah,
limitation.
that's great. One of the kind of the lessons we teach our residents with Parkinson's disease is about the concept of velocity. And it's literally the power that the muscle can exert to get you up out of the chair or to get you stepping forward when your gait is frozen, things like that. And so the programs like Big and Loud, which is a therapy-based program that is exactly what it sounds like, getting people to phonate at a loud volume or use big movements when they're moving. And they're very effective because we really, hammer on velocity and power. And so even when we're doing the Parkinson's program, it's a lot of really pushing the weight forward, driving that force into something. So it's been effective and fun to watch. And I wanted to mention also to your point, because at Asbury we do offer rock steady boxing, and you would think it's just about standing there punching the bag, but it's really this whole circuit of movement that people go through, including lying on the ground, doing stretches on the ground, all stretched out. So I love watching our residents, kind of shuffling into class. They're shuffling gait, very rigid. And when they walk out, it's full swinging arms, turning their heads. They're more interactive and engaged. They feel better. I think it's just like the magic of exercise. I would say as effective as the medication is. It's just like an on switch where things just start firing again and moving again. And it's just so fun to watch. Yeah, it is such a blast to watch it.
Yes, I agree. And in Parkinson's disease, there's a cognitive component to the movement. There's the classic examples that patients really are, the brain is able to generate the movement, but the patients don't do it. Automatically, it's very hard to do it. And the classic examples, even in movies, in the movies Awakenings, when, somebody is really frozen in a wheelchair and somebody else throws them a ball and they're able to lift the hand and catch the ball. Or another example is that patients are in a wheelchair, unable to walk, frozen, and then there's a fire in the building. And then because it's a different context, different cognitive state, they're able to get up and walk out. And so it's really fascinating, that part in Parkinson's disease. And the way I think that physical therapy helps in a way is really to train the brain to perform these big movements and strong movements, first voluntarily. The more you do it, the more you project your voice, the more you move and you swing your arms. In the beginning, it seems awkward and it seems too voluntary. But then the more you do it, it kind of becomes more automatic. And so then patients don't have to think to project their voice. They don't have to think so much to move their, to move their arms or make bigger steps. It kind of gets ingrained again. They learn again the patterns of movements that are more optimal. So yeah, it's really, really, really effective. A repetition of the movement, the optimal movement, it gets stuck in the brain. The brain learns it.
It is. And there's all kinds of workarounds and tricks. And, that's kind of the fun about the therapy approach, is figuring out the magic, the secret sauce for that particular resident. Because sometimes it's a 1, 2, 3, you just kind of count it out and they get moving again, the brain responds to that instruction. Or like you said, context. They have trouble crossing a threshold, then you just kind of disguise the threshold and they're fine crossing over it. It's really interesting, though, like all the different factors and presentations of it. Yeah.
Yes, exactly. And I think you're describing the freezing of gait, which is kind of the specific problem of patients with Parkinson's, where they get stuck in the floor and they cannot really initiate gait, or sometimes as they walk, they just get stuck. They cannot restart again the gait. And yeah, I appreciate always the input from physical therapy. There's all kinds of tricks that you guys use and patients adopt, and then this is their new way of walking, their new way of, balancing themselves. It's great to see that. It's really great.
It is great. Well, Dr. Casavetes, I want to thank you for your time. I know that you're a busy man. Did you have any other closing thoughts for us or any words of wisdom you want to share? Is there anything we haven't touched on that you want to mention?
I think one last point is that overall, after I diagnose somebody with Parkinson's disease, I think about Parkinson's really as a lifestyle change. I'm trying to get the patients to kind of have a lifestyle change. Exercise is a very important part of it. Sleep is very important. Usually, I want to address sleep. Mental health is really, really important as well. And then we definitely look into all the small details, but stress would make anything worse. Poor sleep would make anything worse. Usually, patients that are adhering to their medications, they improve their sleep, they improve their mental health, and they do good exercise. They usually do very, very well. So it's really a combination of things. Um, and I'm very glad when I see the patients come in, and in the initial stages of the diagnosis, there is a little bit of sadness. They think about what's gonna happen to me, how's my future, and they have a lot of symptoms, and then we make those changes, and actually they get better. You expect as we said earlier, the disease to progress, but you focus on some elements, you make some changes within, the Parkinson's lifestyle, and then they get better. They feel so much better, and they do well, for a period of time, and they really appreciate their life, and they have good quality of life.
Right. I love that you tied in all those lifestyle factors because they matter to everybody, but addressing all of those things is a really important piece of this
Yeah,
whole puzzle. So, well,
for
thank you,
sure.
sir. Thank you for your time. This was fantastic.
You're
You should
welcome.
you should come by and check us out sometime. We're up in Gaithersburg near you. But you can come see
Sure.
our brain health center. It's really interesting. But
Yes, I'll be glad to come. Thank you for the invitation. It was a pleasure meeting you and having this nice discussion.